Thank you folks for coming tonight. My name is Ken Sweeterman and I'm here to introduce my wife Gail. We own the business Home Helpers and Direct Link. Home Helpers is we provide caregivers that go to folks' homes and companionship care and personal care. Direct Link is a personal emergency response system that we can install, so no one is ever alone. It's just a push button away from help if they needed it in their home. Tonight we're here to talk about choosing a healthcare facility, which we take pride in teaching ourselves in the community what's available out there besides providing home care. And we believe that definitely folks need to be prepared. If we paired each other off tonight and looked at each other, in the next 10 years, if you're over 55 years of age, you're probably going to have some event, illness, injury, that could change your life. So it's important to plan ahead. So I'm going to turn it over to Gail. She's going to tell you how to choose that wonderful healthcare facility.
Choosing a healthcare facility or a housing arrangement for your mom and dad or your loved one, it usually happens in two ways. One, you're in crisis or you're not. And it used to be there were only two choices. Either you stayed at home and your family took care of you, or you went to a nursing home. That was it. Now today there's a lot of the socioeconomical changes have taken place, and people are living longer, families are spread apart. Of course, with people living longer, the senior population is growing. And then, of course, as the baby boomers come on, it continues to grow. So we do need other options. So housing and home health care options have increased dramatically. There are retirement communities for independent living. There's assisted living and nursing homes. There's continuing care communities, big campuses. There's adult daycare, and there's home care agencies. Now, for example, just in my life, the last few years, my mother had a stroke 2 years ago. She went into rehab facility for just a short while, came out, came back home, and with the assistance of a housekeeper that comes in every other week and some handrails, my mother's just fine. Mom and Dad are doing well. Now then, on the other hand, we had Ken's mom had, several years ago, had a brain tumor. And then she developed, and she went into a nursing home. After that, she had strokes. She was in the nursing home for almost 3 years. And during that time, his dad went to the nursing home every single day. Sometimes he went twice a day. He had a meal there. He did volunteer work there. He was there so much they put him to work. And when his mother passed away, we thought Dad was going to go home and enjoy life a little bit. Without the structure to his day, everything fell apart. Dad didn't eat right, he didn't take his medications. He did not enjoy living alone. He got sick, goes back into the same nursing home where his wife has just passed away, spent a short time recuperating there, and we said, Dad, you can't stay here. He says, but I don't want to go home. So he went to assisted living. At the assisted living facility, he is doing wonderfully, and it was his choice to do this. He stopped driving, but he went there, and he is a social butterfly. He signs up for everything. He enjoys his table mates, the two gentlemen that he sits with, and his medications are on time, his diet is balanced, and he's doing very well. Then I had an aunt and uncle who last year, after a year of a lot of conversations, because all these choices took a lot of conversation and discussion before they got to the actual placement. But my aunt and uncle, after a year of discussion, moved from their hometown that they had known their whole life, from Ohio to Pennsylvania to a retirement community so they could be by their daughter. They're 5 minutes away, and I saw my uncle a few weeks ago, and he says that the house is easy to maintain. He likes being near his daughter, but he really misses home. His independence, a lot of his independence was taken away. He doesn't know the area, and he doesn't know anybody besides his daughter and his son-in-law. But still, they felt it was the right choice for them, and they didn't do it offhandedly. It was a lot of research that went into it to do it. So what are the kind of facilities we want to talk about tonight. How do we determine what facility is the best type? And then how do we evaluate that individual facility to make sure it's the right fit? So the types of facility and home care. We have independent living and retirement communities. And these are for healthy, self-sufficient seniors who want freedom and they want privacy in their own home or apartment. But they also, and they want it easy to maintain. They also want security and comfort and social activities of fellow seniors. Then there's assisted living. Assisted living is for people who they don't have severe medical problems. They may need some personal care needs, maybe with dressing and grooming. They may need their meals prepared. Now, assisted living facilities in Indiana are either registered as unlicensed housing with services establishments or licensed residential care facilities. Now, the largest difference between these two is that the unlicensed can only assist residents with their medication, where a licensed one can actually administer the medications, and they also usually have some more nursing services provided. And if you want more details on that, because you can go through, there's a structure, you can go to Indiana Assisted Living Association. It's in Indianapolis, and you can get it on the computer. So it has a lot of info there. Then nursing homes, of course. These are for people who need 24-hour assistance, 24-hour medical care, and they are licensed as skilled nursing that require intense medical attention or intermediate care, and they can be both. But then the intermediate care is for those needing 24-hour supervision and need almost everything done for them, but they don't need the drastic medical attention. So good sources of information on these, and there's a lot of this. There is a lot out on the internet. There's www.medicare.gov and the National Citizen Coalition for Nursing Home Reform. Now this is also known as NCNR. It's NCCNHR. And this has a tremendous amount of checklist, and they also have on the .gov. They have a 5-star rating that they just instituted very recently. You might have seen it in the paper during the last year. It's a rating system for nursing homes specifically. And while it will tell you in there, there's nothing that takes the place of going and visiting a facility. The rating does give, and some of the numbers in there are self-reported, so take it with a grain of salt. But it can give you the 5-star rating, and the low, the number 1. You can probably be pretty confident with there, but in the middle it can kind of get a little dicey. Now also then, we have continuing care communities, and these are the big campuses, and they can provide you with all levels of care, from your independent living to your skilled nursing care. So this assures you, it guarantees you can stay in one place for the rest of your life. You might move from room to room, but you can stay in one place. And some people find that very comforting. Other people find it rather disturbing if they have to think that they might be going on to the next level. It all depends. Then there's adult daycare also. This is another option for people who just can't stay home alone, and maybe they're living with their families and they have assistance in the evenings and over the weekends, but they need someplace during the day. They can provide socialization and meals. Some provide physical therapy and medical services. Now, and some of the nursing homes also are able to provide this service. They can also, some of the nursing homes also have respite care available, where if you need to go on vacation, you're the main caregiver, they can stay for a week or a month. Then there's home health care agencies such as our own, and that's for those usually who wish to stay in their own home, but they need some assistance. Now, we can also provide assistance and support in the other facilities. Sometimes that's helpful. And our caregivers go in and they provide personal care, homemaker services. They can do medication reminders, household chores, and just helping a person live a better quality of life at home.